Okay, perfect. So thank you guys for joining me. I am here to present on pediatric nursing specialty. Um, sorry, just not, there we go. Not adept at using Zoom. I've been using Google Meet. So give me a moment while I change my screens around here. So I want to acknowledge that I am joining today for Saskatoon, Saskatchewan, which is located in Treaty 6 territory, which is the traditional lands of the Cree, Saulteaux, Dene, Dakota, Lakota, Nakota, and Métis nations. I also further acknowledge that on this virtual meeting place, we have participants joining from across the country within the ancient and traditional and unceded territories of over 630 Indigenous communities, which represent more than 50 nations and 50 Indigenous languages. And I want to commit right now to seek the truth, take action towards reconciliation, and to uphold the inherent rights of all of the Indigenous peoples of Turtle Island. After that land acknowledgement, I am just going to take a moment here and I want to wish you guys all a very happy National Student or Nursing Students Week. I remember well and I acknowledge the dedication, hard work, and passion of nursing students. Thank you all for embracing this academic journey and for your commitment to learning how to care for others during their most vulnerable times. It's pretty clear that every nurse has an ethical responsibility to nursing students. We've all been there, and we must treat students respectfully, encourage them, support them, work to mentor and guide them by sharing our knowledge and experience. This is how we can ensure the future of nursing. I embrace the ability to work as a preceptor and nurse leader, and I'm always happy to help share a student's experience of nursing. As a registered nurse, I am here to support and enhance the professional growth of nursing students and share my own passion. Thank you to CNSA for this opportunity, and thank you all for joining and taking the time to be here for my presentation. This is kind of my plan for the next hour. I'll give you a brief introduction of myself, share about my own pediatric nursing journey through nursing school, working in peds, and especially certification through CAPN and CNA. Then we'll talk about why kids are not just little adults, why you should choose pediatrics, and I'll have hopefully some time at the end to answer some questions and chat with you guys a little more. So first off, hello. My name is Racheal Martens. I'm a registered nurse on the pediatric inpatient department of the Jim Pattison Children's Hospital, and I work in Saskatoon, Saskatchewan. I also currently hold the position of the Director of Communications with the Canadian Association of Pediatric Nurses. I am a member of the Canadian Nurses Association and work with CAPN as part of the CNA network of nursing specialties. I also hold membership with the Canadian Pediatric Society. I'm originally from British Columbia, and prior to nursing, I completed a Bachelor of Human Kinetics and worked with various child, youth, and adult sports teams and associations throughout BC. I graduated with distinction from BCIT in 2009 with my BSCN, and throughout my nursing degree, I took a number of specialty courses in pediatrics, emergency, and critical care specialties. I was fortunate to be able to work while I was learning as an employed student nurse on the acute medicine floor at the Vancouver General Hospital, as well as at the BC Children's Hospital in the emergency department. That's where I truly fell in love with pediatrics and knew that it was more than just a job, more than simply my career. It is definitely my passion. In 2010, just after I graduated, my partner and I moved across the country and I found work on the general surgery vascular floor at the Halifax Infirmary. From 2010 to 2013, before finding a position in pediatrics, I worked there and I gained so much experience in adults, but I also learned that it's not where I'm meant to be. So in 2018, I started at the Isaac Walton Killam Hospital, the IWK in Halifax, on their Med-Surg Neuroscience unit. And I stayed there until 2018. We had two children in Halifax, and in the fall of 2018, we moved again, settling in Saskatchewan in our attempt to get home to BC and closer to the rest of our family. I've definitely found my niche as a peds nurse. I'm awed and inspired by children on a daily basis, both at home and in the workplace. And though sometimes I identify myself first as a nurse, and I am very proud to be a nurse, I am more than simply my profession, and my happiness comes from the variety of roles in my own life that I'm able to fulfill. So my pediatric nursing journey is pretty varied. I've been fortunate to have a variety of experiences in a number of different pediatric settings. I've worked in acute care, I've worked in community, I have worked in home care and peds respite. And all of these different areas are amazing opportunities, and there are so many different ways that we can be a nurse and so many ways that you can be a peds nurse. And I'm thankful that I have been able to experience so many. So back to nursing school, you'll see there one of the pictures of my first clinical group, as well as a picture of my graduation. So my first experience in pediatrics was our pediatric clinical rotation, in which I did on acute pediatrics at the Surrey Memorial Hospital in BC. And this was an amazing experience, and I'm sure it shaped part of my love for pediatrics. We had a wonderful group of students, a passionate instructor, and the staff on the floor was welcoming and happy to have us there to learn from their experience and share the work with them. As a student at BCIT, I was in the fast track program because I had a previous degree, and I was fortunate because the degree and credits that I had come in with allowed me to take on extra specialty courses throughout the completion of my degree. This allowed me to earn credits in emergency critical care and pediatric nursing. It also helped me attain a position as an employed student nurse on both the acute medicine floor at VGH, as well as the emergency department at BCCH during my final year. My experience as an ESN solidified my love of nursing, and my time at the BC Children's Emergency Department highlighted and stoked my passion for pediatrics. When we moved to Halifax so that my partner could complete his law degree, I was a brand new nurse, fresh out of nursing school and eager to find a position. I had interviewed prior to our move and secured a position on the general surgery vascular floor at the Halifax Infirmary. It was not a pediatric position, but my employment there paid for a move and gave me a lot of valuable experience while I worked to get a position in pediatrics. It also kind of solidified my knowledge that although there are a huge variety of nursing positions out there, I really do enjoy acute care, and pediatrics is definitely my love. So after my first maternity leave, I was able to secure a position on the medical surgical neurosciences floor at the Isaac Walton Killam Hospital in Halifax. The IWK is a tertiary hospital in Nova Scotia, and it covers patients from all over Nova Scotia, as well as across the four Atlantic provinces, New Brunswick, Nova Scotia, PEI, and Newfoundland and Labrador. I worked there for 8 years on MSNU, and if Halifax was somehow closer to BC and Vancouver, we probably would have stayed. I definitely would never have left that position, other than the fact that we wanted to be closer to family. So by that point in 2018, we'd been in Halifax for almost 10 years. We had two young children and decided it was time to move closer to home. We wanted our boys to grow up knowing their cousins, being able to see their grandparents and extended family on a regular basis. So in 2018, we started looking for where we could go and what options were available. I knew that I wanted to stay in pediatrics, so we looked at different locations and ended up settling in Saskatchewan, as it's within driving distance of BC, has affordable housing. And we were just on the brink in 2018 of Saskatoon opening up the Jim Pattison Children's Hospital here. So outside of working in the hospital, I am quite involved in pediatric nursing with the CNA and the Canadian Association of Pediatric Nurses. So I wrote my CNA certification exam in 2019, which was the first writing of the CPED-NC, which is Canadian or Certification of Pediatric Nurses in Canada. And that exam, it took a lot of studying because I had been slightly out of pediatrics a little bit for a while at the beginning of my career. And then when we moved to Saskatchewan, I worked in home care for a little bit. But writing that exam and studying for that exam definitely helped me to kind of fill in the blanks of pediatrics and see all the things that I loved and was missing, and definitely helped me to refresh in my own mind and experience all of the things that I loved about pediatrics and why I wanted to get back into that. So, with that being said, I had joined the Canadian Association of Pediatric Nurses in 2018. In 2019, after I wrote the exam, I applied for a representative role on the board of directors then, and was the Saskatchewan representative in 2020, 2021, 2022, and 2023. After attending a couple of conferences and getting to know the CAPN board a little bit better, I volunteered for the external communications officer role and fulfilled that role in 2021 and 2022, as well as 2023. The last role in my current position with CAPN is the Director of Communications, and I have been in that role since 2024. The beginning. Just our roles are 2-year periods and they start January 1st. So I've got one more role or one more year in this position, and it's a very exciting role. I sometimes wonder if I've maybe bitten off a little bit more than I can chew, but it's good to be challenged, and I enjoy being able to communicate and talk with nurses across the country about the concerns and issues that they're having, as well as helping them to find ways to address those concerns and issues. And it definitely helps having worked in 3 different provinces as a nurse and being able to draw on that experience. And it's nice to have the ear of the directors and our executive and be able to kind of flesh ideas out, talk about some of the things that we're going through, and see if there are ways that we can work to support and educate the pediatric membership that we have within our program, and ways that we can share that education with all nurses. I know that in recent years, some of the programs in nursing and nursing schools have pulled away from specialty areas and have made those, I guess, clinical rotations more of a elective than a mandatory part of the program. And so I guess the big thing for me is just realizing that although pediatrics is a specialty, it's not always recognized as such. It definitely is. There's a lot of things that we need to kind of make sure that people know when they're coming into pediatrics. And I guess with that, I'll move on to my next slide. Oh, the picture is a little blurry, but I think you get the idea. Kids playing dress up. So kids are not just little adults. And the things that we learn in nursing about adults are not always straightforward, directly applicable to children. We often forget this fact. In fact, until the mid-20th century, doctors and nurses followed standard medical practices and understood very little about pediatrics and the differences between adults and children. But now we know better, and so we have to do better. We can catalog a number of physiological and behavioral differences, as well as psychological differences between children and adults. And with this knowledge, it is up to us to build healthy environments that protect our children from their unique exposures and allow them to grow and thrive. We know that pediatrics is a specialty, and as such, it does require some specialty education. Our patient populations are constantly changing as they grow, and there's so many more things that we need to know. Growth and development, play therapy, the fact that vital signs, the norms change age to age. We dose our patient medications based on their weight. Our lab values differ, sometimes across sexes and definitely across age. We need to know how to talk with kids, but we also need to know how to talk with their parents. And we need to know different ways to get medications administered, different comfort techniques, different feeding techniques. Kids are definitely a big learning curve, even moving from a position where you've worked as a nurse for a number of years, working in a different area with adults and moving into pediatrics. It's not the same as just starting out in your nursing career, but there's definitely a lot that needs to be learned and a lot of orientation that needs to go along with that. I think for the next little bit, I am just going to talk about why I want you guys all to choose pediatrics. So I chose pediatrics first off because I love working with kids, but I want you to know that that's not enough. Loving working with kids and being a pediatric nurse are good things to have in common, but it doesn't necessarily go hand in hand as we would expect to. A lot of people love children and would never choose to be a pediatric nurse. But there's so many good reasons to choose pediatrics. So pediatrics has a lifespan impact. By that, I mean that as pediatric nurses, the changes and the patterns of knowledge and education that we help our patients and their families with are changes that will impact them the rest of their lives and will hopefully keep them on a path towards health and wellness that sees them not admitted so much into our acute areas. Kids are the future of our society, and if we can work towards preventative instead of reactive medicine and medical model, we will all be better off. Children are amazingly resilient. Kids do better than adults, no matter with almost every single diagnosis. They're resilient and able to adapt. Their bodies are better at recovering, and they are just, honestly, they're just incredible to watch, to see the things that happen and to see the changes that occur in them as we are able to help them on their health journey. There are always increased resources and the ability to fundraise. PEDS is an easy place to spend money. And so it's an easy place to work because we have more resources. We have better supports. And even when things are bad and staffing is short, there are requirements on pediatrics. Though BC is the only province that currently has any hope of attaining nurse-patient ratios in the present, there are always ratios that are set for different pediatric specialties and different pediatric areas in the number of patients that you can have, their acuity, and yeah, it's always better staffed than adults are. The team-based care and supports in pediatrics is like none other. Although all nursing teams work towards collaborative care, most nurses and most nurses tend to be very caring. That's even more apparent in pediatrics. There is definitely less of a hierarchy between medicine and nursing. In pediatrics, a lot more come alongside, and pediatric nurses are valued members of the team. Part of that is because people who don't like pediatrics or don't feel comfortable in pediatrics don't tend to stick around. There's lots of other options, lots of other places that they can be. So our morale on the floors and in pediatric teams is higher. There's fewer people that are kind of sticking it out and waiting around just to retire. Another big impact and big difference between kids and adults and why I chose pediatrics is that again, it goes back to that kids' resiliency piece. Kids don't typically have like a slow descent or much warning when things are going to go bad. But in that same way, kids recover a lot faster and more fully than any adult does, no matter the diagnosis. Um, I guess for me, a big part of it is, yes, the smiles, the laughter, hugs and high fives, popsicles, stickers, knowing your favorite dinosaur, your favorite cartoon, your favorite Disney character, the amount of times you get asked those things on a daily basis. This is how we get through our days. It's how we put our smiles on our patients' faces. You'll never really truly understand until you're a pediatric nurse just how far Lego and coloring books or a favorite stuffy or squishmallow will go and how they're able to occupy the children's mind. It's quite incredible. And I'm just gonna share with you this piece that I've put on the side. So pediatric nurses watch miracles happen in small packages. We hold hands and wipe tears. We laugh a lot and we play a lot. We inspire and we get inspired. We're fixing cuts and we don't typically stick butts anymore, but we used to. Um, they Pediatric nurses are caring, healing, and comforting. We're big kids at heart, encouraging and sensitive, loving. And although it strikes me as something hard to say at times, we definitely often are called angels with stethoscopes, particularly by the families. Now, I know that sometimes that sounds like a great thing to be called, kind of like a healthcare hero. Sounds like a great thing to be called. Just want to encourage you guys not to burn yourself out in the attempt to be an angel with a stethoscope or a healthcare hero, that you are not a martyr for the cause and that you need to take care of yourselves as well. There are so many different ways that we can be pediatric nurses and so many different opportunities that are kind of open to us in this practice and in this area, that it isn't limited to acute care. There are nurses in hospitals, whether they're tertiary care hospitals or rural hospitals, that see pediatrics all of the time. Some of them see pediatrics very rarely. You don't have to work on a specialized pediatric floor in order to be a pediatric nurse. If you serve the pediatric population, then you are a pediatric nurse, and there's knowledge and experience for you in that. We have nurses that work in community, whether they're working in schools, some work out of the community health offices, some work with well baby programs, others work with immunization programs. We've got pediatric nurses that work in rural and home care postings. So sometimes they're quite literally going into the homes of these children and their families and helping them in their homes. We help out with G-tube feeds. We help out with IV and central vascular access device care. We administer medications and we support families whose children have complex medical needs. There are so many different opportunities and so many different things that you can do. I think that's kind of a big part of why I chose pediatrics is that I'm not kind of pigeonholing myself into one spot. I'm not making it so that it's just simply about me being an acute care pediatric nurse and kids come into the hospital, I see them, and hopefully we get them home with their families as soon as possible. That there are so many different options that I could choose to do and still be able to call myself a pediatric nurse and still work with this incredible population that Canada has with pediatrics. I know here in Saskatchewan, our pediatric population is growing. They are the fastest growing part of our population, and the ever expanding population of pediatrics sometimes puts a little bit of pressure on our all of our primary care centers, whether that's in rural areas, whether that's in the bigger urban centers, whether it's our acute care tertiary hospitals, or whether it's outposts and home care community-based different facilities that work with pediatrics. And so as this population continues to grow and change, we're going to need more pediatric nurses. And yeah, I guess for me, that is job security. It's knowing that this is always going to be something that is valuable and something that is valued and needed by nurses across the spectrum. And there are definitely areas of pediatrics that you can choose that are different, that fit. You don't have to work 12-hour shifts. You can work casually. You can work in an 8-hour shift role. You can work 10-hour shift. There's so many different options, but all of those options exist. And it's an incredible, I guess, opportunity just to have so many different areas that we can call pediatrics. I think for me, the biggest thing was knowing that whatever I do with a kid, whatever impact I might have on this child, I'm also impacting their family and their caregivers. And these are impacts that might be small, but they're sometimes remembered in, they definitely impact the larger kind of lifelong, I guess, lifelong journey of our patients and their families. So whether a kid comes in and all we're doing is giving immunizations, I can go home feeling better. Yes, there are tears, and sometimes we have our tears too. But knowing that this patient is going home and they are better protected, they are better served in the community to go out and be part of our community and know that they have that protection, whether it's against like common childhood diseases, whether it's against COVID or influenza, or all of the number of different things that we go. Pediatric research is a huge portion of what is coming in nursing research, and it's becoming a much larger part of the research focus. And part of that is because, again, the funding that is available for pediatrics and the money that people are willing to spend. Now, part of why people are willing to spend that money is, I don't know what to call it other than the cuteness factor. Kids appeal to our hearts. We've all been there. We all know people who have children, whether or not we have children of our own. We all see them in society and know that this is our future. And yeah, it's just incredible that there has been such a huge, I guess, kind of about face and a big pivot within healthcare to put more emphasis on pediatrics. I know our population is aging, and as a society in general, there are a lot of boomers and a lot of people coming up in the next few generations as they age that they are getting into more geriatrics, and that part of that is why we are having such a huge influx of the number of people that are in hospital. But it also kind of like warms my heart to know that there are so many pediatric focused areas that are doing so much good work and so many different things to get involved with in pediatric nursing that are just so incredibly inspiring and are able to kind of tackle that challenge and see what we can do to, again, make our healthcare less dependent on the medical model, which is very reactive, and more dependent on the nursing model, which is more preventative and proactive solutions to the changes that are coming. So I just want to thank you for that opportunity. And I think that my last slide here, just going into kind of a time for comments or questions. And just, yeah, if you guys have anything that you want to know or anything that I can help with, that would be great.
Thank you, Rachel, for the amazing session. Yeah, if anyone had any questions, you can put it in the chat or you can unmute and ask the questions.
Hi, I just have a question about interviewing in pediatric positions. Would you have any like recommendations you would give um like what to say in an interview when they ask you why you want to be a pediatric nurse, stuff like that, or any pointers you could give for an interview?
Absolutely. I remember those stressful processes and going through interviews on my own. So I think one of the biggest things to note when you're going into any interview, especially as a nursing student, a new graduate, is just being open about that, honest and open, and just saying, you know what, you're willing to learn. You know that there is a lot that you do know. You may not have the experience, but you have a willingness to learn. And as far as answering questions regarding what drew you to pediatrics, I think just being honest in that for yourself, whether it can be that you love kids and you have had amazing experiences with working with children in other areas, whether or not it's nursing or even healthcare related, um, bringing that to the table in the interview. So if you have worked with kids in really in any capacity, so working with them as like a babysitter, as a camp counselor, if you've ever been like a lifeguard, if you work in like any sort of like church or religious settings as like instructors, if you are a peer tutor, if you have experience coaching on different teams, all of those things go towards your experience of working with children. And that is the biggest thing that is hard. That's something that nursing school doesn't necessarily teach you, is how to work with kids. And it's a really hard thing to learn on the floor. So if you can come in and say that you have some of that experience, then that's something to build on, then that's always a welcome thing.
Great, thank you.
A question we have in the chat is, how is pediatrics for a new grad? Is it hard/rare to get into? And do most places require lots of previous nursing experience?
Well, that changes. That answer changes over time. So when I first graduated in 2009 with my nursing degree, there was very, very little chance of being hired directly into a pediatric setting. Most places required you to have 2 years of nursing experience, preferably on a medical surgical floor with adults. But now, with the nursing shortages, I work on a floor where we have 45 beds and the ability to increase and flex up to 55 beds in spaces that are not always intended for patients, but sometimes get used that way. We have probably 220 people on our staff list, nurses on our staff list. And there is quite the divide as far as age range goes. I find myself kind of one of the odd ones out, being a mid-career nurse. We have a lot of nurses in their older, like the end of their career. They've got probably 5 to 10 more years and they're looking at retirement. And then we have a huge proportion, probably about like 40% of our nurses are within their first 5 years of nursing. We definitely hire brand new nurses. There are new nurses that are currently interviewing for positions across the country in not only pediatrics settings, but specialty pediatric settings. So areas like NICU, PICU, Peds Emergency. Now, those are places that would not normally have started out hiring brand new grads. And of course, the orientation and training and education is a lot more extended for those positions than if you were coming in with some nursing experience. But absolutely, we hire new nurses, and most of the big hospitals do, just simply because of necessity. We need the bodies, and most of our nursing population is brand new to the career and are just being hired. As far as whether or not it's hard, it's a learning curve. And being students and getting towards the end of your own nursing student career and coming close to graduation, I'm sure that you realize that as things get closer to the end, sometimes there's a lot more pressure and there's a lot more learning to pack into a lot less time. I would say that that's the same with pediatrics. So it's a orientation and education and training are definitely condensed into very short time periods in order to get people out on the floor and out into these positions in the community so that they're able to do the job. But at the same time, there's always supports. So yes, it's hard. Yes, there's lots to learn, but there are a lot of different supports that you have out there. So the supports are there not only for our patients in pediatrics, but pediatric nurses have a lot of supports as well. We have clinical nurse specialists, clinical nurse educators, we have resource nurses, we have dedicated people that work with new grads on our floor to make sure that they are not only competent, but confident in their skills. And it's just incredible to me that some of you guys might be working in these areas in the next few years, having just graduated nursing school. And yes, it will be hard work, but you definitely can do it. And there's definitely support out there, and you definitely just need to, if you have questions, ask the questions. If the person that you ask the question with doesn't have an answer and isn't willing to come back to you or doesn't take the question well, find somebody else and ask somebody else the question. We all have been there. Some of us have forgotten what it's like to be a student and aren't quite as supportive as we should be. But for the most part, when you work in a pediatric setting, there are definitely a huge number of people that are willing there to be that shoulder, to be that guide and that mentor, and have absolute desire for you to succeed as a brand new nurse.
Okay. Another question is, if do you need to write a different exam outside of the NCLEX RN in order to become a peds nurse?
So no, you absolutely do not need to write a specialty exam in order to be a pediatric nurse. In fact, there are a number of pediatric nurses in many different areas that work and do not have certification in pediatrics. So the CPED-NC certification comes from CNA. It is, as I said, relatively new. The first exam is not was written in 2019. And before that, we had no pediatric certification exam. It wasn't fully recognized as a specialty. But that being said, there are no employers across the country that require that CPED-NC in order to work in pediatrics. Most of the people that I work with, as I said, there's probably about 200 people on the staff list on my floor, and there are only 4 of us who have that certification.
Thank you. I think we don't have any in the chat. But I had a question in terms of, I know like a huge component of working in pediatrics is also being able to work with the parents. And usually they do have kind of lots of questions, which is completely valid when you are in like charge of taking care of their little one. So did you have any tips in how to work with like the parents? Because I know sometimes it can be difficult, especially as a new grad when you don't know everything and they're kind of throwing different questions at you. So did you have any tips on like how to better work with families and parents in like pediatrics?
Absolutely. So yes, this is definitely a big portion of my work is working with the children's families, caregivers, and parents, and definitely the hardest part of my job. Um, the questions that they come up with still stump me, but I think the biggest part of that is being confident in the knowledge that you do have, in the experience that you do have, and when you don't know, being able to say, you know what, I'm going to discuss that with a colleague. I'm going to go find some answers for you, and being able to be the person who approaches somebody else. You need to know who your resources and your supports on the floor are, whether that's your CNE, your CNS, that resource nurse, your charge nurse, managers, whether it's the senior nurses on the floor who have been working in pediatrics for 30 years, or whether you need to actually sometimes go to up to the residents and the staff pediatricians and say, you know what, this family member has a question that I think maybe you would be better suited to answering. So I think part of it is just knowing your limits. You need to know what you know and you need to know what you don't know. And if you don't know, there's absolutely no shame in asking and telling the family that you're going to find an answer for them and that somebody else might be able to come back with a better answer.
Thank you. That helps a lot. Are there any other questions that anyone had?
Okay, if there are no more questions, if you guys have a couple of minutes, I'd love to share a little bit about what CAPN is and what the Canadian Association of Pediatric Nurses is and kind of what we do, if that's okay. So the Canadian Pediatric Nurses, or CAPN, is a cross-country group. We are a national association affiliated with CNA that works with the specialty networks in nursing, specifically with pediatrics. Our vision is connection, compassion, and commitment, and we are hoping to lead pediatric nursing excellence. So our mission is to protect and promote the health and well-being of Canadian children locally and nationally by advancing the professional specialty of pediatric nursing through education, learning, and advocacy. We partner with a number of different associations and groups throughout the country to put forward our priorities and advocate at both at like the local, provincial, and national level for all of Canada's kids in order to have a better health and workforce planning program and plan for pediatric nursing and nursing throughout our country. So our biggest pushes are for knowledge and exchange of information, because healthcare is provincial and nursing is different in every different area that you work with. Sometimes in a province you have multiple different breakdowns and districts of where you do your work, different health regions or different health authorities, no matter what those are called in your area. Pediatric nurses are found in all sectors of the healthcare system, all across the country. They have specialty knowledge and skills that are able to help them to effectively care for children all across the growth and development stages. And CAPN supports and recognizes the expertise of these pediatric nurses, and we work to share that knowledge across the country. So one of the ways that we've done that is by creating a set of national standards. So there are 5 national standards for pediatric nursing in Canada. The first is that we support and partner with the child and their family. Our second standard is that we advocate for equitable access and the rights of children. The third standard is that we deliver developmentally appropriate care. The fourth is that we are actively working to create a child and family friendly environment. And the fifth is that we're hoping to enable successful transitions within that plan of care and between healthcare professionals and institutions. So CAPN currently is in the midst of doing our push for an election for our 2025 CAPN executive, and we do have an opening for our student officer role. So if there are any of your members that would be interested in filling that role, the commitment typically is about 1 to 1.5 hours a month, with the exception of July and August. We don't meet over the summer, in which you would meet virtually and exchange ideas with our executive and as part of a committee on either our education or membership engagement committee. And please, if you guys have any interest whatsoever at all, just maybe contact. You can either find my contact information on the CAPN website, which is PAED, PAEDNURSE.ca, or if CNSA wants to forward my information and contact, that would be great.
Yes, we can definitely do that. And I'm just going to put the link to the website in the chat as well.
Okay, perfect.
Okay, I think that's the time. That's the end of the session. Thank you so much.